study.
Have you ever received the flu vaccine?
Yes, I had to because I am an EMT here and Rhode Island law requires all public health workers to be vaccinated.
Did you get it before? Before coming to college? Or I know it's been a while.
I did not get it before college, but I also got it my freshman year here because I was traveling out of the country and it's mandated that you get it.
Okay. So it was just so you think you got the flu vaccine because of regulatory reasons, not really.
Yes.
Okay, so it was. So did your parents ever like spur you like, oh, get the flu vaccine, or was really their influence like non-existent? Okay. Just in general, like, have you ever received the flu vaccine?
Yes, I have. Since I can remember, like every year we've got it.
Every year?
Flu vaccine, and even after coming over here, it was like me and my roommate were like, oh yeah, let's walk together to like I think it was they were giving the flu shots at Joe's, and we walked over there just because we know like it's better to be prepared than not prepared.
Yeah.
So having the flu vaccine was always a good thing.
Okay. So what do you think was your reason behind it?
My reason,
like vaccination.
I did not want to get sick. First of all, I guess knowing that probably weren't eating as well or anything, so having the vaccination was better and like more protection,
Yeah.
Not trying to get sick.
So like before, when you lived with your parents, do you think it was like your parents influenced you to get it, or you just thought like, oh well, I think it's good, I'm just gonna get it? Or you was that like
it was definitely the influence from the healthcare that we got. They were telling my parents to get vaccinated because.
Do you think it was like a good healthcare?
It's definitely been a good healthcare, I believe.
Nope, never received a flu vaccine.
Okay. So what's your like reasoning behind that, or why do you?
I was gonna get one this year, and then my mom told me not to get one. I don't know why. She just has this idea that they will tend to get you sick, and I don't know if that's like common with like lower income families who like aren't as aware of science. I wanted to get one because I kind of like know it's probably better to get one, but my mom kind of dissuaded me from getting it.
Do you think that, being Hispanic or like being first generation or like your economic status influenced you on your choice to get the flu vaccine? Like your background in general?
I think it did because I feel like in like Hispanic families we're just like, oh well, kids get sick, that's what they do. Mm-hmm. So like there's not really like a move towards getting the flu vaccine.
Like being in a minority group and from a low socioeconomic status, you don't get a lot of like information about all these vaccines.
Mm-hmm.
Like you may get like a few like highlights, but you're not really aware of everything that the vaccine what it has and like what it can prevent. And I think that lack of knowledge also may prevent people from getting the vaccine.
Okay, so now, have you ever heard of the concept of herd immunity?
No.
No? Okay, so let me
more.
So now, learning about this herd immunity concept, what are your thoughts on vaccinations?
Well, my first thought is how come I didn't know about this, and how come public health officials haven't done more to educate about that? Because actually, I'm realizing now that that's kind of like a big deal.
Yeah.
It's a really huge missing piece of information that medical professionals, even in your like regular annual physical exams, can definitely address. So, I will say, in addition to that my goodness, I will perhaps have to reconsider some of, what I said. No, I fortunately have taken vaccines for relief, so I actually didn't know about it before I took the course.
I guess sometimes we forget that we are interconnected with other people around us, and not just like an emotional, intellectual, or different level, but that's interesting. I didn't know we were that connected in the health.
Knowing knowing that it protects other people besides themselves, I think would also be a good thing. I guess just knowing the facts would can.
That sounds like it's for the welfare of everybody.
And around just affecting themselves, it's affecting the people around them too. So I think it would really increase or like change people's minds about vaccines. Yeah.